feel this tissue. Now what we can do is, the muscle comes from the posterior iliac crest and major function, okay, and through the aponeurosis. Aponeurosis covers a portion of the thoracic spinous process, all the way connects to the lumbar spinous process, maybe a little bit, yes, to the sacrum. You can ignore that. Just say thoracic aponeurosis. And muscle fibers extend superiorly from T12 to about this region, okay, because this inferior angle about this, okay. So this area, and then its broad muscle belly extends laterally towards the inferior angle. This is the inferior angle of the scapula, and past it underneath the axillary, inserts anteriorly to the intertubular groove. So how can we find? Now I would like you to internally rotate your hand against me. Okay, maybe here. You can use your knee, just like the therapist. Internal rotation. You can put your knee here. Put your hand against my knee. Yes. There, you can feel the muscle contracting. Okay, follow it. If you're tired, okay. Once you relax, then the muscle actually can feel the fascial adhesion right here. Fascial adhesion. You can move your finger along this area. Okay, along this area. Can you do internal rotation again? Now, see the muscle belly, see right here. You can feel the contraction. Once it comes here, right here, okay, relax. So right here, if you see that, this is the latissimus dorsi. On this side, these muscle fibers are accessible, but it's thinning out. When it comes here, it becomes thinning out, and it's very hard to actually grasp all the muscle fibers. Okay, so when we're palpating, like in the treatment palpation, not exam palpation, what are we palpating for? We're palpating for one location, the tension. If there's any tenderness, any hyper or hypotension of the muscle, and feeling the temperature of the skin. Okay, so or texture of the tissue. Is there any scar tissue, or is it normal? But for the exam, when we say palpation, we're trying to test your knowledge of origin, insertion, and action. So that's why when we say palpation, I have to say two different things. Clinical palpation. The video that I show you is a clinical one. In a clinic, how we find this muscle and we try to feel and grasp. This grasp to try to go deeper. So right here, this is the latissimus dorsi. You can feel the muscle tissue. To confirm this, yes, there you go. See, there you go. The muscle. You can basically see that. Okay, there all the way. Keep it. Now it's thinning out. As you hear, okay, relax. The ribs over here is very thin. All right. So for the exam, how do we do that? Just I'm expecting you to say first, if I actually palpate latissimus dorsi, just tell me latissimus dorsi comes from the posterior iliac crest. I'm going to find it, and the thoracolumbar aponeurosis. Okay, this area, and the last 3 or 4 ribs. So that's the 3 or 4 ribs. Okay, 3, and the spinous process between T12 to T7, so the inferior angle area, and this muscle extends superiorly, attaching to the passes the inferior angle, and inserts anteriorly to underneath the axillary area, inserts anteriorly to the lesser intertubular groove. That's it. And then confirmed by action. Can you do so with this internal rotation? And then we can find in this area, the muscle belly is the thickest and most accessible. It thins out over here, becomes very thin, hard, but you can feel contraction though. When you put your fingertips here, you can feel the muscle contract, but it's hard to grasp. Okay? Is that clear? Yeah. Any questions so far? So this is the palpation, but these muscle, I don't think